Welcome to Module 9. Module 9 will be looking at nephrology, the study of the kidneys, and urology, the study of the urinary system. Nephrology is the study of the kidneys, and if you walked into a hospital department, the kidney department would probably be called the renal department. Renal also relates to the kidneys. Urology, meaning study of the urinary system, will look at the urinary system, but also many issues associated with the male reproductive organs. Consequently, you may hear the term genito-urinary medicine. Let's look at a diagram of the urinary system. The urinary system is a system which filters out the waste products from our blood. The blood is carried to the kidneys via the renal artery, and the kidneys then filter out our waste products. Within the kidneys, there are filtering structures known as nephrons. And one of the products that is filtered out from the blood is a substance called urea. This urea in our blood, if allowed to build up, would make us very ill. The kidneys filter out this urea and add water to it, where it is then stored in the bladder. There is an area on the kidney where the arteries and the ureter enter the kidney, and this is known as the pelvis of the kidney. The urine that is made by the kidneys passes through the kidney, out through the pelvis of the kidney, down the ureters and into the bladder, where it is stored. When the bladder is full, urine is passed out of the bladder through the urethra. Root terms. Our first term, nephro, and ren both mean kidneys. Pile is the pelvis of the kidney, so that was the area where the tubes entered the kidney. Ure, or urea, relates to the urinary system, and urea relates to urine. Ureter is the tube that goes from the kidneys down to the bladder. There are two ureters. Cyst, or vesico, is a term for bladder, and a bladder is just a sac of fluid. So cyst is a sac of fluid. Urethra is urethra. Let's look at some words. We're not going to break these down straight away. I want us just to go through the terms, and hopefully in your mind things may start coming to you. Nephropathy and renal disease, they both mean the same thing. Pyelonephritis, hematuria, and the term urology. A ureterostomy, a cystoscopy, and urethritis. Let's go back to nephropathy and let's work out its meaning. So nephropathy, pathy we know means disease, so nephra is kidney, is disease of the kidney. And renal disease would mean disease relating to the kidney. It's the same thing. Pyelonephritis. Well, pyelo was the pelvis of the kidney, nephra is kidney, so it's inflammation of the kidney and the kidney pelvis. Hematuria, well, urea relates to the urine, so what it's saying here is I have blood in my urine. And urology, ology is study of, so it's a study of the urinary system. A ureterostomy, well, ostomy, you may remember, means an opening, bringing something to the skin surface or clearing a blocked passageway. So there's an opening of the ureter. So a patient may have a ureterostomy bag to collect their urine. Cystoscopy. Oscopy we know is visual examination, and cyst is our bladder, so it's a visual examination of the bladder. Urethritis, inflammation of the urethra. These are the general terms associated with the urinary system. Next we will look at some terms associated with the male. Here we have a diagram of the male genitourinary system. So that would be the urinary system, the bladder and the ureters, etc., and the genitals relating to the reproductive parts of the male. Let's talk through the diagram. The ureter is the tube carrying the urine down to the bladder from the kidneys. And here we have the bladder. And the root word for bladder is cyst. It's a sac of fluid. The bladder stores the urine, and then the urine will pass through the urethra all the way out, through the penis, to the outside world. Now let's look at the reproductive organs. Here is a testicle, and in the testicles, or testes, sperm are developed. The sperm then progress to the epididymis, this section here. It's a great word, epididymis, where the developing sperm mature and are stored until the male is ready to ejaculate. When that happens, the sperm pass up through this green tube here, which is called the vas deferens, and it's mixed with fluid from the seminal vesicles. From the seminal vesicles, it will then pass through the prostate, and the prostate gland also adds more fluid to the sperm, and the sperm pass out through the urethra during ejaculation. Having looked at the diagram, it's time to add some terms associated with the male body parts. First of all, the term andro means man. Generally, this refers to the male of the species. Orc or orchid relates to the testes, the testicles, where the sperm are made. Epididymo is the epididymis, and this is a storage duct for the sperm. The vas deferens was the duct carrying the semen and the sperm from the epididymis to the urethra. Sperm are sperm. And the prostate gland, only men have a prostate gland, and it produces some of the nutritional fluid that the sperm swim in. Let's look at some words to break down. Andrology clinic. Well, andrology literally means the study of man. Again, it's related to the male, and so in the andrology clinic, in particular, patients may go if they are having problems with their reproductive organs. It's a study of men, andrology. Orchidectomy. Well, ectomy is removal of, so it's removal of a testicle. If you were going to remove both testicles, it would be a bilateral orchidectomy, bilateral being both sides. Epididymitis. That's a great word to say. Epididymitis is inflammation of the epididymis. A vasectomy is literally cutting the vas deferens. It's not removing it, it's just cutting it, even though it says ectomy. So this would also be considered a sterilisation, because the sperm would not be able to get through. The fluid would still come out, but not the sperm. Aspermia. Well, A at the front of the word means no. The IA at the end of the word is a condition or disorder of, so I have a condition of no sperm. Prostatitis. Inflammation of the prostate gland. The prostate gland is only found in males, and it is located around the urethra, just below the bladder, as you can see on this diagram. This diagram is showing a normal, healthy prostate. We mentioned earlier that the prostate gland, along with the seminal vesicles, add fluid to the sperm for ejaculation. Let's look at an enlarged prostate gland. Here you can see the enlarged prostate has squished the urethra, so the urine in the bladder can't actually get out. And the chap who has the enlarged prostate gland would have what's called urinary retention and would not be able to pass urine. An enlarged prostate gland can be associated with something called BPH. This stands for benign prostatic hyperplasia. Hyperplasia we can break down. Hyper means increased, and plasia was the formation or growth. So here we have an increased formation relating to the prostate gland, but it is benign, and benign means it's not cancerous, it's not dangerous. Maybe inconvenient, but not dangerous. Increased growth of the prostate gland, but not cancerous growth. As we mentioned earlier, this enlarged prostate gland squashing the urethra will make it very difficult for the man to pass urine. If you suffer with an enlarged prostate gland, you will show signs of prostatism. And this is a term to describe a group of symptoms associated with an enlarged prostate gland. And these would include frequency of passing urine and nocturia, passing urine at night, noct relating to nocturnal, nighttime. If a patient has an enlarged prostate gland, they may be sent for a TURP, a TURP. This stands for transurethral resection of the prostate gland. Well, trans is actually a prefix that means across. If you think of a transatlantic flight, it's a flight that takes you across the Atlantic Ocean. So trans is across, urethral, well that relates to the urethra, and resection means removing. So here we are going to remove the prostate across the urethra, so to clear the blocked passageway. An instrument would be passed up through the urethra to scrape away part of the prostate gland. In order to assess whether an enlarged prostate gland is benign or cancerous, one of the tests that would be performed is something called a PSA. This stands for a prostate-specific antigen. The prostate produces this protein, and if you have an enlarged prostate gland, it produces more. It is a type of protein that is found in the blood. However, a high level of prostate-specific antigen does not on its own signify prostate cancer, but it is considered a marker, one of the factors to be taken into account. Urine is actually made by the kidneys by filtering out the substance urea, and urea is a toxic waste in the blood. Urea could be also written in the root form UR. Let's have a word with that in. Uremia. If I had uremia, this would imply that I have a blood condition of urea, UREA, the toxic waste in the blood. Creatinine is another waste product, and you produce creatinine when you use your muscles. And the waste product is again put into the blood where it is filtered out by the kidneys. And one thing that can be measured is something called the creatinine clearance rate. It will tell the doctor or the nurse how efficient your kidneys are at filtering out the waste. Urea, spelt with an I, can also have the same root term, UR, meaning urine. And the term proteinuria means having protein in your urine. Protein should not be present in urine. Proteinuria would imply an infection or possibly kidney disease. Reflux. We've had the term reflux before. We had reflux esophagitis, when acid goes backwards up your gullet. Well, we know reflux means backward flow. You can actually have a vesico-uretic reflux. So the reflux is a backward flow. Uretic means relating to the ureters, and vesico was another word for bladder. So what we have here is urine backflowing from the bladder up the ureters towards the kidneys. Not good. Our next term, incontinence. Incontinence relates to a leakage, or in this case, a leakage of urine, so urinary incontinence. But you can have incontinence of the bowel as well. Retention. We mentioned this term earlier. It's the inability to pass urine. So if a chap has an enlarged prostate gland, he may have urinary retention. Inability to pass urine. Voiding relates to urinating, and urinating is passing urine, so a patient may have voiding difficulties. Urinary retention would be a type of voiding difficulty. Also, some children and adults may not actually empty their bladder properly and have a little bit left sitting inside. This would also be a type of voiding difficulty. Micturition is a posh word for passing urine, and somebody may have a micturating cystogram. Cystogram, we can break that down. Gram is our tracing, cyst is the bladder. So in this case, it's a tracing of the bladder whilst you are having a wee, whilst you are passing urine. Enuresis, a common term, means involuntary passing of urine. Classic example, nocturnal enuresis, otherwise known as bedwetting, nocturnal being nighttime. A catheter. A catheter is a tube that is inserted into the body at any different places of the body to allow drainage. Catheters are commonly used in urology and nephrology to drain off urine. An abbreviation is CSU for catheter specimen of urine. Next we have some abbreviations. Abbreviations. MSU is a midstream urine. This is a common test where you would pee in a little pot and the doctor or nurse would examine your urine for blood or protein. CSU, catheter specimen of urine. A UTI is a urinary tract infection. If you have blood or protein in your urine, this may be an indicator that you have a urinary tract infection. Next we have IVP or IVU. These two things refer to exactly the same test. IVP stands for intravenous pyelogram and IVU stands for intravenous urogram. I believe the intravenous urogram describes what is going on more clearly, so let's look at that word first. Urogram, or gram we know as tracing. Uro relates to the urinary system. So we're going to have a tracing of the urinary system. In order to do this, some dye will be injected within a vein. And within a vein is intravenous. Intra means within, venous relates to the vein. The dye put in the veins will allow the soft tissues of the urinary system to show up on X-ray. Intravenous pyelogram would break down as a tracing of the pelvis of the kidney, and intravenous saying within a vein, you're going to put some dye in. But this test will still be looking at the whole urinary system. They are both the same thing. A PSA relates to prostate-specific antigen. This is an antigen which is produced by the prostate gland, and if you have an enlarged prostate gland, more prostate-specific antigen is produced. U's and E's, or U and E, relates to urea and electrolytes. Urea is the toxic waste you find in the blood, which is then filtered out by the kidneys, and electrolytes are things like sodium and potassium. We've had words such as hyponatremia, meaning a blood condition of reduced sodium, and we've had hyperkalemia, meaning a blood condition of excess potassium. Your electrolytes if out of balance, will make you feel quite poorly. CRF refers to chronic renal failure. So the kidneys are failing at doing their job properly. It's chronic, so it's ongoing. A similar term is CKD. This relates to chronic kidney disease. Chronic kidney disease really relates to kidney disease in old age. Let's break down some words. Orchitis. Orc, break, itis. Itis we know is inflammation, and orc was the testes. So the inflammation of the testes. Urethritis. Let's break it down. Itis is our ending, so it would be inflammation of the urethra. So that's the tube going from the bladder to the outside world. Nephrolithiasis. Let's break it down. Nephrolithiasis. Iasis is the ending, meaning condition or disorder. Lith is a stone and nephro is kidney. So what we have here is a condition of having stones in the kidney. Cystolithiasis. Let's break it down. Cysto, break, lith, break, iasis. There's a pattern arising here. It's a condition of having stones in the bladder. Let's try another one. Ureterolithiasis. Break it down. Uretero, or ureter, relates to the ureters. That's the tubes going from the kidneys to the bladder. Lith is stone. Iasis condition. It's a condition having stones in the ureters. Urolithiasis. Uro meaning urinary system. So this would be a general term saying I have a condition of stones in the urinary system. Cystectomy. Ectomy, removal of. Cyst is bladder. Removal of the bladder. If I have removal of the bladder, I will require somewhere for my urine to go. And this operation may be performed in order to solve that problem. Ureterosigmoidoscopy. Let's break it down. Uretero, break, sigmoid, break, ostomy. Well, ostomy is opening. Sigmoid relates to the sigmoid colon, and the ureters are the ureters. So what we have here is an opening, sigmoid colon and ureters. What is going to happen is the ureters are going to be attached to the sigmoid colon, so the urine produced by the kidneys will pass into the sigmoid colon and therefore out through your anus. It's an opening of the ureters into the sigmoid colon. Our next term, pyeloplasty. Plasty is our ending, meaning surgical repair, and pyle was the pelvis of the kidney, where all the tubes sort of enter the kidney, the pelvis of the kidney. So that would be surgical repair of the kidney pelvis. Intravenous urogram. Intravenous and urogram. Well, intravenous was within the vein. They're going to pop some dye in. And urogram was the tracing of the urinary system. Proteinuria. Let's break it down. Urea is our urine, so this is protein in the urine. Hematuria. Let's break it down. Urea is urine, hemat, blood. So it's blood in the urine. If I have problems with my kidneys, there is a chance I may have oedematous ankles. Can you remember what the term oedema means? Oedema meant fluid, so I'd have fluid swelling of the ankles. And another time we had this term was in relation to the heart. If there is right-sided heart failure, a patient may have fluid-filled ankles. Gravity pulls excess fluid down. Hypertension. Hyper, tension. Increased tension. High blood pressure. Nephropathy. Pathy is disease, disease of the kidneys. Obstructive uropathy. Well, obstructive is obstructive, it's causing a blockage in some fashion, and uropathy would be disease of the urinary system. So therefore, obstructive uropathy would be disease of the urinary system due to an obstruction, such as having kidney stones. It's time for In Your Head. Here I'd like you to think about the root terms on the left-hand side and think where they would go on the diagram. Off you go. The first one, vesico. Well, vesico is one of the root terms for bladder. I may see the term vesico-intestinal, which would mean relating to the intestines and the bladder. Another word for bladder is cyst. Ladies in particular get cystitis, inflammation of the bladder. Artery with an I is artery with a Y. Ven is vein. Nephro is my kidney. Phleb is also vein. So I could have phlebitis, inflammation of a vein, or we might be talking about the venous return, as in the blood from the veins going back to the heart. Pile is the pelvis of the kidney. Ureter is the one going from the kidney down to the bladder. So there are two ureters, but only one urethra. That concludes Module 9, and it is quiz time. If you want to go back and revise anything, please do. And when you're ready, on the left-hand side, you click on your quizzes, and off you go.